Like many things, the medical field has been turned upside down by the pandemic. But as Neil Jones explains, there is one local doctor who prefers operating the old-fashioned way.
Dr. Brad Apple runs his office the old-fashioned way. So what does that mean?
We know our people. I mean, they're all like family to us.
From the old-fashioned filing system to the extensive one-on-one FaceTime with a doctor, this is clearly not your normal medical practice.
And this place has kind of become a little country practice in the middle of an urban area.
That's befitting a man born, raised, and educated out in western Kansas.
My mother was a nurse and my dad was a farmer, so I grew up with, medicine was in my life the whole time.
Maybe that explains why Dr. Brad Apple's unlike just about any other doctor in the Kansas City area.
Dorothy, your grandma? Yes, sir. They right in the house. They know that coming.
Name another physician who still makes house calls.
It hurt a little bit, huh?
Yeah, that left one is real sensitive.
He's been treating Dorothy Walker for decades.
He's my hero. He's my hero.
Homebound after a serious fall, Dorothy counts on her visits from Dr. Apple.
And he does that for all of his patients. He has that hands-on care.
House calls end up costing doctors time and money, but this doctor says that doesn't matter.
And I feel like they need to be seen and looked at, but there's no, rational way that they can make it to the office.
That slogan on his sign, putting patients first, he actually means it, but it's becoming harder and harder to do.
I love the people, but the system, I don't like at all.
And the daily struggle of having to deal with that system has Dr. Apple and other physicians wondering if they even want to be primary care physicians.
It's ran by, the insurance companies and the federal government. And, I've always viewed that I work for the patient. I don't work for any of these guys.
He says that doing the right thing is becoming more and more difficult.
It's very easy to sit somewhere, 1,000 miles away here behind a desk and say, we think this is a good idea, and never see the pain and suffering that we see day to day. I think they need to come in, they need to sit down and see what we're actually dealing with.
Dr. Apple no longer wants to be part of a medical system that he says is not meeting the needs of its patients.
We have people making decisions that think, well, this sounds like a good idea. Well, they didn't think of the other 200 things that make that not a very good idea.
Physicians will tell you that his business model won't work, that it eats up too much valuable time. But Dorothy and his other patients shouldn't worry, because while he'll no longer own his practice, he'll still take care of his patients. And that means he'll continue to get in his car and make house calls. He's a throwback to a simpler, some would say, a better time. In KCK, Neil Jones, KCTV 5 News.
And Dr. Apple predicts that in 10 years, most primary care physicians will be replaced by nurse practitioners and physician assistants who cost less than doctors.